My name is Dr. Rick Sigil.
And action. Hey, Jay had a... This is Kirk And action. Hey everyone, it's Dr. Rick. Michelle had a question about atypical chest pain. I should say chest pain, but I deemed it as atypical. Now, there's many reasons for it. I do have a video I did before, about 4 years ago, on chest pain, so I'll put a link down below. It gives a brief explanation about different reasons. But in this case, middle-aged gal with some stress, business owner. Bottom line is that we have to make sure it's not a heart attack. However, I'll get into that in a second. If this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I post new videos. So I put down cholesterol as being the typical thing that modern doctors blame on heart attack, but it's more complicated than that. And I really think insulin's more of a trigger for that. However, let's get into it. Those of you who have who follow the cholesterol hypothesis, that's fine. I think there is some data that shows that when you have or need a stent, there usually is, the majority of times there will be a risk factor, and we as doctors will usually find or look for a cholesterol level as being elevated. But there are other factions that don't necessarily just blame the cholesterol. So if we blame cholesterol, we will try as best as possible to bring down that cholesterol. And there's a great pharmaceutical industry that just puts out millions of different pills for, I shouldn't say millions of pills, but there's a few pills, million prescriptions or more that have been prescribed because especially in America, there is a lot of heart attack and there is a lot of stenting and there is a lot of bypass occurring. So the question would be, if the cholesterol is the only risk factor that you have to worry about with all the medicines, why are we still having heart attack as being number one and number two killer in the United States? So I think it's important to accept the fact that cholesterol is a marker. So when we get blood tests in the office, we always have to get blood tests fasting. And it's fasting because it gives a better indicator of what your baseline cholesterol will be. And the cholesterol and lipid panel, it involves checking for total cholesterol, an LDL, which is considered the bad cholesterol, an HDL, which is considered a good cholesterol, and triglyceride level. Now, all cholesterol is very important, especially for fatty. So cholesterol is, in a nutshell, fat, lipid. And lipid is very important to encircle and make up a cell membrane for every cell in your body. If you didn't have a cell membrane, like those of you who followed the COVID capsule is lipid, and it has to bind with the cell, like the lung cell, so that it connects, and then when it opens up, the contents of the COVID RNA go into your cells and take over production. So you have to have cholesterol. But unfortunately, with the standard American diet, I believe that it induces inflammation. So when it induces inflammation, sometimes cholesterol, if it's floating around, can get oxidized. And when it gets oxidized, it will attack the lining of the blood vessels, all of them. Stroke, heart attack, blood vessels thrombosing or getting blood clots, lung failure, leaky lungs. So I think that it's going to be I don't want to make this a long talk. I'll be giving, my promise to be giving a talk on the endothelial lining soon, especially with COVID, probably surfacing in about 2 to 3 weeks with all the riots. But the first thing is a lipid profile. So it gives you a marker. If you have an elevated total cholesterol or LDL, that might be enough to say, let's work on your weight. And I put down at the bottom, which should be at the top, body mass index, waist-hip ratio, and history. Do you exercise? Do you smoke? So we put it down here because we don't make too much of it, but with my lifestyle change, I put it up top. It's very, very important. But sometimes just using those parameters, people will not be inspired to make change. Thus, we get these targeted things and hopefully induce fear. And fear-based change, incentive fear-based change usually is spooky when you leave the doctor's office, anxiety causing, but it loses its motivation after you don't see the doctor for a while. And then after a while, it's like you're just taking a bunch of pills. So I would always say, if you can afford it, get an NMR. An NMR is a more specific breakdown of total lipid particles, total LDL particles, size of the LDLs, size of the HDLs, triglycerides. So it is expensive. It's considered experimental, but some insurances will cover it. Again, I think it gives a better risk factor evaluation to see if you have the bad cholesterols or if you do have very small particles versus large particles. I don't want to get into the details of that, but I would rather have NMR. EKG is okay for looking at your heart at the time. But if you're not having a heart attack, if you're not stenosing off the blood vessel, narrowing it off or choking off, you're going to have a normal EKG. If you have chronic damage, it'll be hot, it'll be a positive. But at the time, if you're having chest pain, it is okay for an EKG to be letting you go home. But you still have to get what I think is a gold standard stress echo. The true test is a cardiac catheterization where they put dye through your groin into the heart and they look at your blood vessels, but there's risk factors with that. So I think a stress echo, depending on who does the echo part, that's when you get on a treadmill, and then after tolerating 3 minutes at increasing intervals, they lie you down and get a picture of your heart. I think that's reliable. Sometimes a stress thallium, where they inject you after the stress is over and you see the heart light up or not light up, that would be helpful, but that is important. But that's only ordered. That's ordered by me, but it's only approved by a cardiologist, unfortunately. I used to be able to order these, but insurance says, nope, you gotta go through a cardiologist first. So I always have to have a cardiologist on the team. I like to see markers of hemoglobin A1C. And hemoglobin A1C tells you, if you have a normal CBC or a blood count, it tells you about how bad the glucose has been in the last few months, 3 months specifically. So it gives you a good indication that you might be a little bit pre-diabetic or diabetic, but it usually becomes positive later on. If your waistline is high, if your waist-hip ratio is high, if your BMI is high, I can tell you what your hemoglobin A1C is going to be. Give it 5 to 10 years, it'll eventually flood over and be positive, but I wouldn't wait for that. I would do an insulin test. Random insulin in the morning, fasting, I think is more of an indicator. When you use this and glucose together in something called a HOMA-IR, gives you an indication that you are insulin resistant, and I have a video on that, so check that out. A 2-hour glucose tolerance test would be very, it's accurate, but nobody wants to sit there for 2 hours. Usually we just do this for pregnant women to find diabetes that's developing, because that's the cherished patient. We have to take care of that patient because it's actually 2 patients. High sensitivity CRP does indicate sometimes that there's inflammation occurring in the blood vessels. And then usually, if I can get my patients to buy into it, a calcium score, which is a CT scan of the heart. I think all those things do give me a little bit of scaffolding to say, is this high risk or is it not high risk? In Michelle's case, half and half, but we'll get the rest of the blood tests. Chest x-rays obviously are very important to rule out lung. Stomach acid and H. pylori, also important to rule out stomach, because with this COVID and the riots, everybody's stomach is acting up, and that can throw chest pain over here or down the arm. So it's very fooling, but actually the majority of times it's going to be stomach related, but because of the heart being so devastating, if we ignore it, if you go to hospital, we always rule it out. So that's the first thing that's ruled out. Once it's ruled out, then we take our time as an outpatient with a workup. So this is where I would say is important to consider. Those of you who worry, or if I say, hey, your cholesterol is high, we got to bring it down. It's just one of the markers that I use, but it's just important to understand that your doctor should be ordering the other things I just mentioned, because it gives a broader picture about who you are, what you've been eating, what we have to change. And sometimes it is covered by insurance, but all that, the list of things might not be covered by insurance. So old school would be, hey, just lower the waistline, get exercising 3 times a week, high intensity, stop the crappy food, and then let's see what happens. But sometimes, as I mentioned, threat incentive is usually short-lived. So having a team put together, which I always rely on, a coach for exercise, a coach for nutrition, a coach for calming practice is really important. Might not be covered by insurance, might be paying for that out of pocket, just as expensive as paying for the blood test. But I think if you're going old school because you don't have insurance, I'd rather have coaches because they can follow you through. Instead of seeing me every 3 to 6 months for these tests, coach will follow you through, make sure you are accountable to that coach. And I think it's a lasting change, a lasting effect, and highly sustainable versus me just threatening that this blood test is high, let's put you on an herb. This blood test is still high, let's now put you on a medicine. This blood test is dangerously high, we failed herbs and medicines, let's get you to a specialist. Once the specialists are on your team though, they reserve no quarter. They go 110%. Cholesterol medicines, diabetes medicines, blood pressure medicines. I love my specialists, but usually they're a little limited as far as lifestyle change. And I love lifestyle change. The objective is to be a change that will get you to sustain healthy lifestyle so you can live to 103. So hopefully this gives you a little bit of an idea about what you should be getting, how you should be motivated, and even if you don't believe in the cholesterol, I think that it still serves as a marker to see if what you're doing, what you're initiating as change is working or not. So don't forget to subscribe to me. Send this and share this with other people who are on the fence as far as, well, do I have to do this? And otherwise, I'll see you at the next video.